Hello and welcome to this webinar, which is part of the Your Health, Your Wellbeing and Your Numbers series of information webinars. And this one is focusing on sleep, rest and well-being. So my name is Helen Donovan. I'm one of the associates in nursing working at C3 Collaborating for Health with my colleague Lola Kahende, who's not here with me today, but she's been part of this piece of work. So C3 Collaborating for Health is a charity aiming for a world where nobody is going to die from preventable chronic diseases or non-communicable disease. Those things like diabetes, heart disease, respiratory illnesses, often made worse or caused by the way we live our life. Now, there's lots of information on the internet and other places. And one of the things about this piece of work is to try and help people explore the facts from the myths that are out there, what's good and what's bad information. And one of the ways that we would recommend that is to use this patient information forum PIFTIC and look for yourself. Is there a date on it? Where is it coming from? Does it look professional? Is it actually trying to sell you something? Does it include sources or references that you can go away and look into in a bit more detail? And is it backed by other organisations? Look particularly for things like the World Health Organization or the NHS, or sometimes medical or nursing royal colleges. So sleep, rest, and well-being. How many hours of sleep do you get it in a night or in a day in 24 hours? And is that enough? And how can you improve that? How can you improve the amount you sleep? We need sleep. We all of us need sleep. It improves our physical and our mental health. And getting enough rest boosts the way our brain functions. It boosts our mood, and it improves our overall well-being. And lack of sleep increases multiple disorders, as well as your mood and your ability to cope with life. So you need to protect our mental health, enhance your quality of life, and maintain that status and that quality. So the NHS suggests that on average, adults need to get between 7 and 9 hours of a night. And obviously, we're all different. The reality is you probably don't get enough if you're constantly tired during the day. And you need to remember as well is that sleep is cyclical. We go through, and what's here on this image of eye rapid eye movement, and you go through phases of this. So non-rapid eye movement and then rapid eye movement, which is often the time when you dream, and then you get to a point where you become a little bit more awake even, and maybe even wake up, and that's normal. What's not normal is not being able to go back to sleep. So think about that cyclical approach to sleep, and that's really important for all of us. What's good for our habits is to have a good sort of sleep hygiene. So stick to regular sleep wake routine as far as possible. Don't be tempted to lie in if you've had a bad night. Wake up at your normal time. Get some natural sunlight. I'm recording this in the winter. The clocks have just gone back, and we all get maybe not enough time out in the fresh air and in natural sunlight. So try and make an effort to do that. Get some exercise every day. It's really important to boost our overall morale. Improve, avoid nicotine and caffeine, particularly close to bedtime. It takes about 6 to 8 hours for that to wear off completely. So don't be consuming caffeine maybe after sort of early afternoon onwards, because it will inhibit your ability to sleep properly. Try not to take naps after mid-afternoon. Naps are sometimes fine. We're all different, but if you're going to have naps, make sure that they're relatively short, maybe about 20 minutes, and take them before 2 o'clock in the afternoon. Avoid alcohol and large meals before bed, and develop a routine. Limit screen time. We think a lot about screen time for children, but actually adults as well. So don't have your phone on, don't be scrolling through information just before you go to bed, but maybe try reading a book. listening to soothing music, trying some mindfulness, and make sure that that sleep environment is right. So not too hot, not too cold either. Make sure that there's not too many distractions from sight, sound, and light, and make sure it's relatively dark, and that will help your overall sleep and your ability to get to sleep. So this is a one way of sort of thinking about it, and it's called the 10-3-2-1-0 rule. So 10 hours, 8 to 10 hours before you go to bed, stop consuming caffeine. 3 hours before you go to bed, stop eating or drinking alcohol. 2 hours before you go to bed, stop working. Try not to be working. Give yourself some rest time. 1 hour before you go to bed, stop looking at those screens. And then 0, don't hit the snooze button on the alarm. When the alarm goes off, wake up. And if you can't fall asleep after about 20 minutes, get up and do something relaxing. Maybe listening to some soothing music, reading a book, and a proper book, not on screens. Maybe making yourself something, a calming hot drink, such as a herbal tea or something, and then try to go back to bed. Don't just lie there tossing and turning. Some people actually suffer from a more serious form of not being able to sleep, and this is called insomnia. And this is where you have repeated difficulty getting to sleep and or staying asleep, and it can be really disruptive in a partnership as well. Waking up several times in the night and then not being able to go back to sleep, waking up early and not being able to go back to sleep, feeling tired during the day and not being able to function properly. And if this does occur, then really you need to go and talk to a medical practitioner, get some support. Um, Women at a certain time of their life, if it's menopause or perimenopause, that can affect the way that you sleep. Talk to your employer as well, because the way you sleep and the quality of your sleep will impact on your ability to do the job properly. And employers need to be able to support that and support you to be able to function properly. And this is some information from a national UK charity called the Sleep Charity, and pointing out that 20% of accidents in the workplace list fatigue. So really important from a workplace health perspective that we are rested and that we're able to do that job. 1 in 6 crashes resulting in death and injury on the motorway are caused by fatigue. Those signs that you see when you're driving, stop, take a rest, really, really important, because we know that that's the impact of not sleeping, the impact of being tired is that you won't be able to function properly and you may well be involved in an accident. 60% have experienced their attention span being negatively affected by a bad night's sleep more than once. And 75% of the people in this survey said that workplace challenges had caused issues with their sleep. So there's a sort of cyclical approach to this. So really important for employers and managers to take this seriously. So from a manager's point of view, promoting flexible hours and wellness programs so that people do sleep better, and stress reduction techniques, encouraging mindfulness, encouraging that sort of attitude to having good rest periods during the day is really important. So again, the sleep charity has this becoming a friendly workplace, so being supportive, managing stress, promoting better sleep, and improving employee well-being. Reducing stress enhances performance, boosts engagement and motivation, and it helps to foster a positive workplace where individuals are able to do what they need to do in the right way and reach their full potential. So in conclusion, prioritizing sleep is really as important as looking at your diet and looking at the way you're exercise and keeping good physical activity making sure that we are maintaining good health, getting into a good sleep and wake routine. So having that time during the day to get out into the fresh air, being exposed to sunlight, and look at some of the resources that I've pointed out, particularly from the sleep charity. There's a lot of information on the NHS website. The Self Care Forum have a lovely poster called Boosting Your Mood, which also talks about the importance of sleep. So, some resources there for you to have a look at, and get some more tips. So thank you for listening. And as ever, I'm going to pass on to the next slide, which is the QR code, because we really want to hear your thoughts about these webinars. So follow the QR code, click on the video recording for this session, which is obviously about sleep, and then complete the online form giving your